Hello, and welcome to this introductory presentation on the managed care elective rotation that we have here at Employers Health. My name is Matt Harmon. I'm the Senior Director of Pharmacy at Employers Health for the last 7 years, and I'm excited today to be joined by the clinical team here to discuss all the benefits that we have at this rotation that we feel is a unique opportunity to learn about managed care in the best setting possible. So, we'll go over a brief overview of what Employers Health is, since you may never have heard of us before. We'll talk about the benefits of the rotation and some expectations, and then finish it off with a little bit of student survey feedback. So our history at Employers Health, we started in 1983 up in Canton, Ohio. Some employers got together to discuss what's the best way to manage their healthcare spend. Generally started just from educational opportunities, networking, that sort of thing, and then expanded in the next decade into purchasing of group pharmacy benefits. And that's where we spend the majority of our time educating our clients about the best way to manage their healthcare spend and trend. We feel our why is really different at Employers Health. So we're a coalition. We bring employers together. We're a nonprofit organization. We're not governed by any for-profit entities. Our board of directors is made up of our clients, and we have about 40 plus team members now. So it's more than doubled since I've been here. We have attorneys. Now we have 4 pharmacists on the team. We have our analytics team, and while our headquarters is up in Canton, we have about a quarter of our staff here in our Dublin office, where you as a student would be located, and the full clinical team is here, as well as our analytics team, some account managers, as well as some other people within our organization that will give you the full experience to learn all kinds of things you wanted to know about the pharmacy benefit. So our employers are located all over the country. We have employers headquartered in 34 states now, with lives in all 50 states, and they run the whole gamut of industry. So we have Zappos.com in Las Vegas, to the University of Nebraska, to Wendy's here in Ohio. And what really makes it unique is that each employer is a little different and has different requests, and the student gets to potentially interact with those clients during their month here, answer their drug information questions. And we'll get into more of that as the presentation goes along. So you may be wondering, what's the interaction with the pharmacy benefit manager? Sometimes the PBMs, they get a bad rap, but that's what we're here to try to be, that independent clinical resource for our employer members, try to provide that support. We can offer clinical recommendations based on their formulary, and just overall trying to be the best resource for our clients so that they have the lowest drug cost possible with the least amount of disruption, so that their employees are happy. So now I'll turn it over to Kelsey to talk about the benefits of the rotation.
Thanks, Matt. There are multiple benefits of completing a rotation at Employers Health, and as you can see here, we've divided them up into 5 different buckets. So the first bucket is professional development. So if you are interested, our team of pharmacists can review your CV or resume and provide content feedback. And we can also conduct a mock interview, which is great practice to help you prepare for residency or job interviews. There are multiple networking opportunities for our students as well. So as Matt mentioned, we work closely with other pharmacists from our 3 PBM partners, and we also meet with pharmacists in the pharmaceutical industry, which provides many opportunities for you to grow your network. Work-life balance is really important to us here at Employers Health, and this includes our students completing at a rotation at our site. So your schedule will be Monday through Friday from 9 to 5 each week, and you'll also have your own individual workspace and 1 hour for lunch whenever you choose. Managed care exposure is one of the main benefits of this rotation. Rotations within managed care can be difficult to come by, so we're really happy to offer this opportunity to students, especially being so close to Columbus. So as discussed previously, we work closely with 3 of the country's largest PBMs, and this really provides a unique experience for our students, particularly when it comes to learning about formulary management. So during this rotation, you can learn about the similarities and differences between PBMs and formulary design. And you also have the opportunity to learn about how we identify potential gaps in benefit design and how we develop custom utilization management strategies. So as mentioned, we meet with pharma representatives often, and we try to schedule those meetings when we have a student with us. Those meetings are very informative and consist of a variety of topics, and some of those include expanded drug indications and new pipeline drugs. And you will also have the opportunity to develop your analytical skills if that is one area of managed care that you are interested in. So we review and analyze pharmacy claims weekly to monitor for high-cost drugs and identify any relevant trends. So there are a lot of opportunities for you to learn about data analytics. Ultimately, we like to tailor your rotation experience around you and your personal interests. So any projects that you complete can be customized to an area that you are interested in learning more about. And you're also treated like a member of our team during your time with us and have the ability to join all of our meetings. We do not believe in busy work and try to make your time with us as beneficial as possible. And then one last quick benefit that we're really proud to offer is complimentary access to the Fundamentals of Managed Care Pharmacy certificate, which is offered by AMCP. So it's always great to save money as a student. So this is an added bonus of the rotation here at Employers Health. And this certificate program has various modules and videos that cover all aspects of managed care. So it really helps you gain a better understanding of what managed care is and how pharmacists play a key role in this setting. So once you complete that certification, AMCP issues a badge seen here on the left that you can display on your LinkedIn, or you can list this as an additional certification on your resume or CV. And now I'll turn it over to Kevin to discuss what you can expect during your time with us.
So what to expect at our rotation? While you're here, we do have a mix of projects that do take more longer processes, such as days to weeks, and we also do have day-to-day activities such as drug information requests. The drug monograph and prior authorization project is something that you'll work on throughout your whole rotation, and that's something that you get to touch base with Matt, Kelsey, Hannah, or me to discuss and develop as you go. One of the key things that we do allow our students to do is to shadow in meetings with both our PBM and pharma representatives. This helps you gain some insight on how certain meetings are run, as well as understand our relationship with them on a more deep basis. One of the biggest things that we do is we also expect our students to present to both our pharmacy team as well as our extended team to help practice some of those key skills that you'll be using as a professional. Depending on the timing of the year, you also do get a chance to travel to client sites. Many of our students that have done that in the past have often found that to be a valuable experience for them. As far as work environment goes, we really do encourage an open door policy with all our staff. We have about 12 to 13 members that work here, and we have our students walk around, ask questions, engage with our other team members to participate in projects that they may be interested in. The key in our rotation is that this is very independent and project-based, and we think this is a good representative of what our life is on a day-to-day basis as a managed care pharmacist. We hope that you take your time to learn how to organize and how to prioritize to help you identify which tasks you need to have done versus which ones could probably be pushed back and given more time depending on the nature of the work. Overall, this is your month. We want to help you achieve what you're trying to do, and professional development is a key thing that we have here. Next, I'll have Hannah kind of talk about some of our feedback from some of our former students.
Thank you, Kevin. So as you can see, based upon our final evaluations of the past, we do have a perfect track record for having our students recommend our site as well as our preceptors. We really love having students, and our preceptors and even the other staff are very supportive of having our students. So even if you know anyone who have had this rotation before, please reach out to them because I'm sure they have plenty of great things to say. If you are interested, we look forward to seeing you here.
All right, yeah, if you made it this far in the video, I appreciate you taking the time to learn more about our organization here at Employers Health. We would be happy to have you as a student on rotation, so please feel free to reach out to any of us. Our emails are here, and please check out our website we have some educational materials there. And if for some reason the rotation scheduling does not work, we also offer the ability to shadow us for a day. So feel free to reach out and learn more about our organization. Thank you.